Look forward to the next 50 episodes. Tonight we'll be talking about inflammation and what you need to know about inflammation. And actually what we're going to be doing is there'll be a little test at the end. I'll end it, and then whoever wants to stay on will be able to stay on and go through the test. Okay, so it looks like the YouTube link is not working. Let me try it one more time. It says it's working, but let me just check, and then we'll get started. One moment. Okay, it is working. All right. So let me share my screen. And as I said, we will be, there will be a test at the end. You don't have to stay for that, but I made a short test. And welcome to all the new people. I see there are a whole bunch of new people who are here tonight. And I always introduce myself as Dr. Carp. Many of you know me because I'm president and founder of Miracle Noodle. And my goal, as I always say, is for you to become your own authority in health, which basically means not that you ignore experts, but that you become a resource for yourself to be able to make decisions for yourself and for your family. And you can feel as though you know how to vet experts so that you can make those decisions. So anyway, let me share my screen and we will get started. All right. And as always, if you have any questions, just go to the chat section and you can make comments. I see people congratulating me on 50 episodes. Thank you so much. Okay, so this is basically the outline of what we're going to be talking about tonight. We'll be talking about what inflammation is. We'll go through risk factors, disease-associated, blood markers that you should know about, drugs to combat, and lifestyle changes, which obviously will be the most important part. If you have been watching a lot of my videos, you'll know that that's what we focus on here. What are the things that you can do concretely that are going to make a difference in your health? But I also spend time and really think that it's sort of a cardinal rule now. One of my main things that I try to get people to do, which is to take control over your own lab tests. In other words, in this case, we'll be talking about one particular blood test that I recommend that you should ask your doctor to order, or just go and get it done yourself. This is one of the things that I try to spend some time convincing people that you, as much as I think you, of course, you should be involved with a doctor that is helping you to optimize your health, but sometimes conventional doctors aren't necessarily aware or concerned necessarily with some of the things that can have a great impact on optimizing and making you feel better and optimizing the chances of you growing older in a healthier way. And in that case, you have to take control over your own health and push your doctors to make those decisions. So let's start with what inflammation is, getting sort of the definition down so that we can get a better understanding of it. And this is from Robbins Pathology. This is a book that we learn in medical school, and I took it down from my shelf. I haven't gone through it in quite a bit of time. They published a pocket companion, which I've had since medical school, and this is what we would review before exams. I had a chance to kind of look through it. This is from, wow, I was reviewing this in 1993 and published in 1991. But some of these definitions, when it comes to things like inflammation, are always going to hold true. And what is Robbins Pathology, this sort of classic textbook of pathology, have to say about what acute inflammation is? And this is what it says. It says, acute inflammation, the reaction of vascularized living tissue, so tissue with blood vessels, the reaction of that to local injury. It is caused by microbial infections, so physical agents, chemicals, damaged or necrotic tissue, and immunological reactions. So reactions from your immune system. The role of inflammation is to contain and isolate injury, to destroy invading microorganisms and inactivate toxins, and to achieve healing and repair. However, inflammation and repair may be potentially harmful, causing life-threatening hypersensitivity reactions, progressive organ damage, and scarring. So what I'd like to focus on and why we're starting this way is to make it clear that inflammation in and of itself is a vital process in your body. You wouldn't be able to heal wounds. You wouldn't be able to fight infections. You wouldn't be able to contain these insults if it weren't for the presence of acute inflammation. Unfortunately, there is something called chronic inflammation. But before we get to that, let's just go review these causes from the definition. So infections, physical agents. This could be a wound, something like that, that's going to surround the area to initiate a healing response. Of course, chemical insults, necrotic or tissue that's dying, and immunological reactions. So the consequence of your immune system being activated in a necessary way to protect yourself. Your immune system, of course, is like the front line, it's sort of part of the front line of defense from protecting against things from the outside. That's what your immune system does. It's like an army that is waiting to protect you from the environment. So these are all acute causes, and these are necessary. Your acute inflammation that occurs in your body is an absolutely vital and necessary and healthy response. Now, what happens when you have resolution of this beneficial, necessary inflammation? Well, one is that you get complete resolution with restoration of the site to normal. One is, if you think of like a wound, you get healing with scarring, but the inflammation goes away. It's just left with some scarring. And then the third is progression to chronic inflammation. And that's what we're going to be discussing now. So we've really focused so far tonight talking about acute inflammation, why it's important, why it happens, why we need it. But now we're going to move into talking about chronic inflammation. And that essentially is inflammation that is continuing beyond acute, meaning it's continuing for some reason. There are three causes listed according to the classic medical school textbook that I reviewed. One is persistence of the inciting stimulus. So whatever caused that inflammation is continuing, or because there's some kind of interference with the normal process of healing. One is repeated bouts of that inflammation could trigger this situation where it goes into just continuing inflammation. But the most common is this insidious low-grade smoldering response. Think about it that way. Sort of like this flame that is just sort of slowly burning to a point where, in fact, you might not even know that it's burning. Think about when you have a fireplace and the fire's died down, but you can see there's a little flame. The embers are still glowing a little bit. It's smoldering. That response, and when that's happening, then it's not really following the classic acute inflammation. It's this essentially chronic inflammation, and some people now are calling it inflammaging because it's so associated with a lot of the negative consequences of aging. So we've spoken about persistent infection, prolonged exposure to toxic substances, and I think that requires a little bit more of a outline. So far, because we're doing things sort of in somewhat detail in the very beginning and then end with lifestyle modification, I want to really get into the weeds just a little bit. So inside your cells is something called the mitochondria, and that's the powerhouse of your cell. You might want to remember that because that's going to be on the test at the end of tonight's. So the mitochondria is known as the powerhouse of the cell. Think about it almost as the battery inside the cell that's sort of powering the rest of the cell. That's why it's called the powerhouse of the cell. And what unfortunately can happen when it's exposed to all kinds of toxic substances, things like tobacco smoke, environmental toxins, as well as just negative, as well as the release of things as that, in other words, inside your body, as during regular processing of things in your body, you get a release of things that are inflammatory. And when your body is producing an enormous number of those, your body is actually producing, in response to regular processing, lots of potentially inflammatory things. And so that's what we call endogenous stressors. So amongst these sorts of things, what happens is the mitochondria, this powerhouse of the cell, you get declining mitochondrial function. And why is this important? Now, it's important because a couple of things happen here. The mitochondria, believe it or not, it's like a cell within a cell. In fact, you inherit your mitochondria from your mother, and it's basically inherited. In other words, you get it directly from your mother, and it's inside the cell. And a lot of sort of evolutionary biologists think that during the process of evolution, it was almost like a bacteria that got into the cell, and it sort of once it got in there, was able to exist in sort of some symbiotic relationship to provide and become the powerhouse of the cell. So it's a very interesting thing, this powerhouse of the cell, when you look at it from a biological perspective. It's like a cell within a cell. It's like a bacteria almost within the cell. And it has a membrane. So obviously, if it's inside the cell, it's separated from the rest of the cell by a membrane. And when you have these free radicals, these inflammatory particles, it can cause damage to the cell membrane. So there it is. It's sitting inside the cell. It's nice and cushioned from the rest of the cell, sort of floating inside the cell with a nice membrane. And unfortunately, here comes these free radicals, and you get a release. The membrane starts to weaken, and you get leaking into the environment. Now, when that happens, the cell detects that. It realizes that there's something wrong. And basically what happens is you get these things that sort of bind together, and they're called an inflammasome. When you get this sort of leaking into the cell, it's sort of like, if you think about, if you have a pimple and you were to squeeze the pimple, and sometimes, it bursts underneath the skin, and that causes an enormous inflammatory response. So there you have a very small pimple, and then you squeezed it, and instead of it popping out, it popped in, and you get this big inflammatory cyst-like response, because it's that the stuff that's inside isn't meant to be under the skin. Same thing here. You have this cell that's cushioned, it breaks open, and what's released into the cell floating, and it's not supposed to be there. And it basically triggers this whole sequence of events that can actually cause a destruction of the cell, because the immune system has actually been alerted to this quote inflammasome, and it can actually destroy the cell. So from declining mitochondrial function, you can actually get a destruction of the entire cell. And that's really what's basically happening. So what is causing this signaling? Obviously, we spoke about free radicals, but let's go into it a little bit more in depth. So we'll talk about this a little bit later, but this is called advanced glycation end products, otherwise known as AGEs. And this is where sugar binds to protein. And we'll talk about that a little bit more, but obviously this is going to be, you're going to get more of these when your blood sugar is going up. The problem with sugar binding to protein is that it never, once it's bound, it never goes away, which changes the quality of that protein and is essentially an inflammatory type of thing. Also, oxidized LDL. Now, many of us have heard of LDL. It's a type of cholesterol. And LDL by itself is just part of the cholesterol particles. But when it becomes oxidized, it's very, very dangerous. And what causes this oxidation of LDL? So in other words, AGEs, oxidized LDL, elevated homocysteine, which we've spoken about before, that's often associated with B vitamin deficiencies. Anyway, all of these are going to potentially cause a creation of an inflammasome, leading to potentially destruction of the cell. So a lot of us don't realize that some of the things that we may or may not have associated, like blood sugar, can ultimately sometimes go all the way back to the mitochondria, leading to damaging of the mitochondria, leading to cell destruction. The most important thing is to understand that now that we're talking about oxidized LDL, there are various things that can contribute to oxidized LDL. Trans fats, which used to be used more than they are now, but they're still in products. They go under the name of hydrogenated or partially hydrogenated. That might be on the test at the end. Smoking is going to also oxidize LDL. And basically, you know, we all think about high LDL being, or high cholesterol being, a problem. Well, it's super problematic when the LDL is oxidized, such that if a lot of your LDL is oxidized, the number could be normal, but if it's all oxidized, it could be very, very dangerous. Diabetes, which is also going to increase your AGEs, and glycation, which might be on the test at the end. Glycation, remember, is protein and sugar being bound. So people who have diabetes often have high levels of AGE. And that's one of the reasons why diabetes is a problem. Metabolic syndrome, which is sort of a constellation of things like high cholesterol, high blood sugar, high triglycerides, all the obesity, all these things sort of combining. Pollution, and even stress, and even mental stress is going to cause potentially an increase in oxidized LDL. All of these things potentially leading to signaling of and membrane leaking, and basically potential destruction of cells. But all leads back to the powerhouse of the cell, this mitochondria. Okay, so let's move on. And so we went through that. Other things, of course, like autoimmune phenomenon are going to cause chronic inflammation, and other lifestyle factors in general are going to lead to overall inflammation, chronic inflammation. Excess calories is another factor that just, you have to realize that if you are eating too many calories, your body is not really equipped or prepared to be able to handle that. And it's going to, obviously one of the things that can happen is it can lay down more fat. We'll talk a little bit more about fat in particular and why that causes inflammation. Elevated blood sugar is going to cause those AGEs, the glycation, the sugar binding to the protein. And a blood test called Hemoglobin A1c that I recommend that I gave a class many months ago about the blood tests that you should get. Well, hemoglobin A1c, many of you are very aware of that test because most people know people with diabetes, and they know that they sort of follow the hemoglobin A1c. That is a measure of glycation. It's a measure of the sugar binding to the protein of the blood vessel. Oxidative stress, we've spoken about many times before. Okay, so we now have a relatively clear understanding of the benefits of acute inflammation and why it's necessary. We have a pretty good appreciation of chronic inflammation, why it's happening, and what is happening in terms of the interaction with the powerhouse of the cell, the mitochondria. So let's move on to various risk factors, some of which we've already talked about, but we're going to go into a little bit more detail. So as we age, unfortunately, there is an increase in what's called inflammatory cytokines. Now, a cytokine is basically a chemical messenger that's released by your immune cells in your immune system. And they're like a chemical messenger. And so the immune cells release what are called cytokines. They're chemical messengers, and they can be pro-inflammatory. They can increase inflammation. They can do the opposite as well. So cytokines by themselves are not necessarily, it's part of the immune system. But when they are activated in a way that's pro-inflammatory, there are certain cytokines are released, that's going to increase the overall inflammation in your body. It's like your immune cells are screaming that there's a fire going on, and they can contribute to the fire that's going on. Unfortunately, as we age, we get a net increase in the amount of pro-inflammatory cytokines. So you get these chemical messengers that are not helping the problem. And we've spoken on other weeks about sort of what you need to do to eliminate these cytokines. Of course, that would take us far afield from what I'd like to talk about tonight, but obviously it's going to help eating lots of green vegetables and getting your sleep and overall the general things that we're talking about. So let's talk a little bit about obesity and fat. Now, fat, technically, when you look at its function, is essentially an endocrine organ. So many of you know what the endocrine system is. It's basically your system of hormones. It's those organs that, that are releasing hormones, thyroid releasing hormones, the pituitary releasing hormones, the male and female sexual organs have releasing hormones, etc. So the endocrine system basically is where something is releasing something that's affecting other types of things. Again, sort of like a chemical messenger in a way, but not from an immune system, but from an organ. So fat, believe it or not, is not just sitting there. It's an endocrine organ. It's releasing cytokines and other types of hormones, believe it or not. And there's a difference between visceral fat and other fat. And visceral fat is basically the fat that surrounds the organs, especially in your abdominal cavity. And that particular fat is associated with a whole host of medical problems. And one of the reasons why this visceral fat is more problematic is because it secretes 3 times the inflammatory cytokines as fat cells elsewhere. So fat cells that are just not surrounding your organs, maybe, hanging from your arms, as an example, that is not as active releasing these cytokines as visceral fat. And as a result of that, this visceral fat is associated with a lot of negative health outcomes, just having more of that visceral fat surrounding the organs. But the point I want to make here is, one, is that we should pay attention and understand the difference between these fats, but also that fat is not just sitting there. And therefore, the more fat we have, regardless of how we are healthy in other ways, is going to contribute to an overall increase in inflammation, especially if it's the visceral fat. Obviously, diet is going to play a role. Mainly too many calories. Again, as I said, when you're eating too many calories, your body just doesn't know what to do with that, unfortunately, and it causes net inflammation. Trans fats, we already mentioned that. Again, we're looking for this may be the test at the end, we were looking for on the label something that says hydrogenated or partially hydrogenated oils. And I can just say, as an example, we are at Miracle Noodle coming out with a line of a very low carb meals that will help people who have chosen to be on a keto diet. And remarkably, we had a sauce that the company that helped us design the sauces right before we were about to finish, said that it had hydrogenated or partially hydrogenated oil in it. And this caused, obviously, a great deal of problems because there's no way that I would put a hydrogenated fat in any of my products. And it really came down to the wire because we had a lot of, commitments for this product, and we really needed it to get it finished. But there's no way that we could, there's no way that I would put a hydrogenated oil. And what was amazing was that, that it was a small amount. So the manufacturer didn't think that it would be much of an issue. But if you look at the data, you don't actually need to get that much trans fat to increase the inflammatory rate in your body. And also, not only that, but essentially what's happening with this trans fat is, again, you only need a small amount and the risk for heart disease goes up dramatically. And unfortunately, sometimes it can be hidden in some of these sauces. And, maybe with one serving, it's less than a gram. So it could be reported as zero. Unfortunately, if you're eating many, many servings of this, then that can potentially be a problem. So we had to reformulate and push the manufacturer who cooperated. But again, we were up against this deadline. But anyway, thankfully, we were able to solve the problem. And I really believe that we all need to be conscious of looking for, and it might be on the test at the end, partially hydrogenated or hydrogenated oils on the label. That's very, very important. Getting back to calories, saturated fat, obviously, there's been a lot of back and forth. Some people say saturated fat is not an issue. Some people say it is an issue. There's no question that if people have an issue with blood sugar or with obesity, saturated fat is associated with an increase in inflammation. If you have a low body fat percentage and everything else seems to be okay, it hasn't been associated with an increase in overall inflammation, but it is something that you really need to be conscious of. So moving right along, that was just something. This actually just happened the last couple of days with this sort of new products that we were coming out with, and we were just amazed that it wasn't disclosed at the very beginning, only until the end. And of course, everyone actually in my whole family, when they saw that, said, "No way are we going to do that." So anyway, moving along. So abnormal sex hormones, basically, usually as you age, when your sex hormones get lower, go lower, there is some association with an increase in inflammation. And sometimes people are recommending, hormone replacement. I'm not necessarily in that camp, but I can definitely say that basically, if you get everything else right, there are various lifestyle strategies to optimize your hormones, or at least, slow the decrease by lifestyle. Smoking, of course, is inflammatory. No one needs to talk about that. Periodontal disease can be associated with quite a bit of overall systemic inflammation, believe it or not, meaning overall inflammation. So it's important that you see a dentist to make sure your gums are in good shape, because that can be, it's associated with some autoimmune diseases, believe it or not, like psoriasis. It's increased risk for heart disease in people who have high periodontal disease. This is a sort of not unknown, but lesser appreciated, I should say, risk factor for overall inflammation. And sleep disorders, elevation of these cytokines. Remember those chemical messengers from the immune cells. Believe it or not, we've spoken about the circadian rhythms in your body, and your cytokines, the pro-inflammatory, anti-inflammatory, et cetera, actually also have cycles. There is a role for inflammation. We've we've already spoken about how you need a certain amount of inflammation at certain times, certain instances. Well, when you have a disruption in your circadian rhythms and you have sleep disorders, your overall inflammation is going to increase. The vagus nerve, poor vagal tone, and one way we spoke about this at length on another episode, but basically this is balancing out your nervous system, getting enough rest, and making sure that you're balanced in that regard as well. Okay, moving right along. And again, this psychological stress also plays a role here. So your overall inflammation is going to be increased by psychological stress, that sense of being in an emergency state, that feeling when you drop a glass, the people are in when someone cuts you off in the road. All of these are contributing to overall inflammation. And that's something that a lot of people ignore. They're eating their kale salads and they make their superfood smoothies, and they're getting good sleep, but all day long they're fighting and screaming and having internal fights. Their buried rage inside. That is going to just offset everything. It's something that you really need to be conscious of and pay attention to, for sure. So Shadi's asking about the blood test. That we'll get to that in just a moment. Okay, so disease associated with it, cardiovascular disease, cancer through sort of upregulation of certain genes can increase risk for certain cancers, diabetes, macular degeneration associated with inflammation. And this, amazingly, I had a patient who I put on a diet. She had macular degeneration. I'm certainly not an ophthalmologist, and she went on a very high vegetable diet, and her ophthalmologist called me on the phone and said, "What are you doing? Like, her macular degeneration, was like 80% better." There's amazing things that can happen when people make dramatic lifestyle changes. So much so that it almost makes me feel uncomfortable to share some of those things, because they are so dramatic. From from reversal of cancers and very amazing things happen, is all I can say. That, and anyone who's associated or been associated with lifestyle medicine and getting people to change their lifestyles, it's more than you would ever imagine it can do, by any stretch of the imagination. Osteoporosis is associated with inflammation as well. There are cells called osteoclasts, which basically resorb, sort of take away parts of the bone, and those are activated by those inflammatory cytokines, those chemical messengers from the immune cells that are inflammatory. And therefore, those osteoclasts are activated and they take away bone. And that's going to be a contributor to osteoporosis. Depression has been associated with inflammation. Whether it's a secondary effect or not, we're not really sure, but there's no question that part of depression should be addressing lifestyle issues, because there can be improvement in symptoms of depression by going on various things like an anti-inflammatory diet. Cognitive decline has also been shown to be associated with inflammation. Now, there are various blood markers, but the one that you really should be, I think, asking, and it was one of the 7 blood tests that I recommend that everyone get. And I don't know what week it is, but if you go to YouTube and look on my page, you'll be able to see my lecture on the 7 blood tests everyone should get. Well, high sensitivity, that's what the HS, CRP is, C-reactive protein, is really a very good measure of overall systemic inflammation. And quite frankly, I think every one of you should get that checked. You should all know if you have overall inflammation in your body. And this one is a very good test. Cytokine testing is becoming more popular. TNF alpha and IL-6. We spoke a lot about interleukin 6 in one of the aging lectures that I spoke about. But both of these are associated with inflammation, and you're seeing more lifestyle medicine practitioners, I guess I could say, ordering these. But high sensitivity, CRP, is really the one that you want to get. Most doctors are aware of this test because there was a very popular heart disease study that came out a couple years ago that showed that it was a very good predictor of heart disease. But overall, so they're not necessarily thinking about it in terms of overall systemic, overall inflammation. Most doctors, they think of it more because of that study being associated with heart disease. But quite frankly, we're looking at it, it's a good indicator of overall inflammation. Additionally, remember we spoke about hemoglobin A1c. That's a test that you're probably a relative or you yourself have gotten checked because of essentially blood sugar. So blood sugar basically is the hemoglobin A1c is a measure of glycation. And that glycation, which we spoke about, which is the sugar binding to protein, is really basically a measure of glycation. And the glycation is happening all over. So it's, happening in your retina. That's why people with diabetes have issues with diabetic retinopathy. So an overall measure of hemoglobin, of glycation, you can get with testing hemoglobin A1c. Okay, drugs to combat metformin. We're all familiar with metformin, and well, not all of us are. It's come up many times. We have a lot of new people on tonight's class. Metformin has been used for type 2 diabetes and has also been associated with some reductions in cancer rates and is potentially a longevity-enhancing medication. Of course, aspirin, low-dose aspirin, and low-dose statins. There are some lifestyle medicine doctors who prescribe these in very, very low dose because they have an anti-inflammatory effect. But generally speaking, I think there is a role for low-dose aspirin still. There are a lot of anti-aging experts who are taking metformin. There are various other ways of activating what happens with metformin, and we'll talk about that in just a moment. Okay, so let's get into lifestyle markers, and then we'll get into our test if you're interested in looking at that. So, of course, let's close some of these things. We're going to cover some of the things overall. Obviously, you want to make sure your blood sugar you're not loading your diet with things that are making your blood sugar go up. Blood sugar is a critical factor in overall aging and certainly in inflammation, which we've spoken about thus far. Decreasing fat, we've spoken about that and how important it is to be conscious of the fact that fat is an endocrine organ and is releasing various pro-inflammatory cytokines and hormones. A closer look at high sensitivity C-reactive protein. There were several studies, one in particular, that looked at dietary constituents based on whether it would raise CRP, and things like tea, beta carotene. So those are, green and orange vegetables, magnesium, turmeric, genistein, which can be found in some soy products, and plus or minus, but mostly fiber has also been associated, specifically soluble fiber associated with improvements in C-reactive protein. Those are just dietary constituents. Remember, we've spoken quite a bit about other lifestyle factors. So I don't want you to think that HSCRP is just modified by diet. It's going to be modified by all the things that we're talking about in terms of lifestyle changes. The paradox of exercise is that exercise is an inflammatory phenomenon, but your overall net inflammation goes down when you exercise. And when you're spending a lot of time lifting weights and doing a high intensity exercise, that is an inflammatory response. But your body is able to adapt to that. And it's like a positive inflammation that overall reduces your net inflammation. Getting your vitamin D levels in order. Again, that's another one of those tests in the 7 that I recommend in that one particular lecture. Zinc and selenium. Certainly, this zinc is important for people to be getting. And we've spoken about that at length because of COVID. You want to have a good level of zinc intake. As I always say, most people overdose on zinc. You really only need like 10 to 25, 15 to 25 milligrams per day. Beyond that, you don't need. Selenium, omega-3s can have a net anti-inflammatory effect, but you want to make sure that you have a good reason to take omega-3s. And that would require another lecture, but if your triglycerides are high, is one indication. Obviously, if your HSCRP is elevated, maybe that there's a role for it. The important thing is that when you take a supplement, you should have a good idea of why you're taking it. It's often that I'll have a patient come in with a big bag of bottles, and they don't know why they're taking the majority of the supplements they're taking. Glycation, so we spoke about glycation, and remember that's sugar binding to protein. And how do we help with that? Well, one way is to reduce calories. The other is to activate AMPK, and this is one of the reasons why metformin, that medication, works. Now, this is known as the master switch of the cell because it regulates energy usage, it decreases inflammation, and it increases insulin sensitivity. It's again known as the master switch, and a lot of people, a lot of anti-aging gurus take metformin to activate AMPK. But you can also activate AMPK by doing intermittent fasting, by using certain herbs. This is a tea that I like to drink called Gynostema, and fostering metabolic flexibility. And metabolic flexibility is basically the ability of your body to burn sugar and burn fat. So you want to be able to switch between those very rapidly. One of the ways to do that is to do something called biological fasting, which is a reduced calorie diet for 5 days. It's something that we'll have available on our website very soon. But it's basically 1,100 calories. I don't want to get into too much detail. I don't want to confuse everyone, but there's a type of fasting where you get to eat a certain amount of food. And so, pay attention to my talks in the future. We'll be releasing that very soon, along with a full educational 3-month program. I'm pretty excited about that. But what it does is it allows you to activate metabolic flexibility. When we're eating sugar all the time, unfortunately, our insulin levels go up too much, which prevents us from burning fat. And therefore, we're not metabolically flexible. We're not able to go back and forth between burning sugar and burning fat. And that's a problem. But when you increase metabolic flexibility, you also increase AMPK. Additionally, it also allows you to reduce your visceral fat. There are various types of fasting, and there's some controversy about whether or not intermittent fasting is or isn't good for this visceral fat. But one thing is for certain, that there have been studies to show that restoring metabolic flexibility, especially through what's called biological fasting, otherwise known as fasting mimicking diet, does do a very good job at getting rid of that visceral fat that's 3 times more sort of inflammatory than the regular fat on your body. Okay, so we've covered everything, and I went a little longer than I wanted to. So let's go through the test. If you want to stay, that's great. I'll just stop sharing my screen here, and we'll go to the test. Next week, believe it or not, we're going to be talking about cannabis. And many of you probably are aware that I've spoken about, let me just, hold on one moment. Let me pull up this test. Oops, 1 second. Okay. Okay. Many of you are aware that I've spoken about CBD and how you don't need cannabis to activate CBD. There are lots of herbs, like lavender as an example, that can help relax your body through this, what's called the endocannabinoid system. And many of you are also aware that I have somewhat of a negative opinion of the use of marijuana and that part of cannabis. And I'd like to go through that in next week's class. There are obviously medical indications that are important, but sort of this general popularization of cannabis, I think is generally a negative thing, and I think you'll find it to be an interesting lecture. Okay, hopefully you can see my screen. Let's preview the test. Oops, that didn't work. Let's try this again. Okay, tests. Sorry about this. Inflammation, and let's see here. Sorry about this. Okay, maybe we won't be able to do it. Okay, here we go. All right, start. All right, so first one, and by the way, I'm assuming everyone can see this, and you can type in your answers as we quickly go through this 15 questions. If you don't want to stay, that's totally fine. I get it. A lot of us have negative opinions of tests, but just something that I wanted to try. Okay. Okay, so we already have people putting in the answer. So acute inflammation is an important part of your body's response to the environment. And of course, the answer there is true. Very good. Very good, everyone. Everyone's getting that one right. Great. Okay, next. What part of the cell is associated most commonly with the damage of chronic inflammation? The nucleus, the mitochondria, the Golgi body. Ooh, Helen's quick. Wow, people are lysosome. Okay, yes, everyone's getting that right. It is the mitochondria. That is correct. Wow, you guys are fast. Okay, next is the mitochondria is also known as the detoxifier, the powerhouse of the cell, or the storehouse. My gosh, you guys are fast. The storehouse of genetic material. Correct. Everyone's getting that one right. The powerhouse of the cell. Excellent. Next, what is glycation? Another measure of blood sugar, sugar binding to protein, cellular communication across membranes. All right, very good. Everyone's getting that right. So it's sugar binding to protein. And the important part of that glycation thing is that it's irreversibly bound, meaning it's just not going to release itself. And that's what's causing not only the damage, but also signaling inflammation. Very, very good, everyone. Maybe my questions are too easy. Which is more dangerous, trans fats or saturated fats? Okay, all right. Wow, you guys are really fast. Right, trans fats are definitely more dangerous. What blood test should you ask your doctor for to test inflammation in your body? LDL cholesterol, hemoglobin A1c, HSCRP, SGPT. Okay, very good. Now we should be checking hemoglobin A1c, and that's a test for glycation. And again, everyone should look at my video on the 7 blood tests that you should know and get an order from your doctor. All right, next. AMPK is known as the powerhouse of the cell, the master switch, or the cell's brake pedal. Okay, I think maybe next time I need to make these questions a little bit more difficult. Correct, AMPK is the master switch. The powerhouse of the cell is the mitochondria. Next. What is metabolic flexibility? A, the ability to touch your toes, the ability to burn sugar all the time, the ability to easily switch between burning sugar and burning fat, the ability to burn fat all the time. Okay, everyone's getting that right as well. And I'd like to point out that, the ability to burn fat sort of all the time, I guess you could consider it being ketosis. And quite frankly, a lot of people who are in ketosis all the time lose the ability to efficiently burn sugar, meaning that they're not metabolically flexible. When people are in long-term ketosis, meaning they're not cycling in and out, just a piece of taking several grapes or having a little bit of pasta, unfortunately can cause their blood sugar to go sky high because their body is not used to handling burning sugar. This is one of the many negative effects of being in ketosis all the time. That's why almost all authorities now do recommend that people go in and out of ketosis. And when you do that, you are maintaining metabolic flexibility, meaning this ability to easily switch between burning sugar and burning fat. Okay, question number 9. What is a cytokine? A substance that causes you to get sleepy, a substance that is secreted from muscle cells that communicate to the blood, a substance released from the brain that helps with weight loss, a substance released by immune cells that have an effect on other cells. Okay, next time I'm going to make these a lot more difficult. So that's correct. A cytokine, which you're going to hear me talk about all the time, is a substance released by immune cells. It can be inflammatory, pro-inflammatory, or it can be the opposite. It is just simply a chemical messenger. Unfortunately, certain pro-inflammatory cytokines do go up in response to all the things that we spoke about. And that is something that can both be measured, but is also a way for us to understand what's happening that's causing this inflammation. Okay, next question. If fat were an organ, what system would it belong to? Okay, would it belong to the circulatory system, the endocrine system, the detoxification system, or the immune system? Okay, so the answer is the endocrine system. So because it's releasing hormones, it's releasing cytokines, it's acting at, it's basically releasing things. Remember, we spoke about that. Interestingly, just talking about detoxification for a moment, some people do believe that there are many fat-soluble toxins, and some people believe that when people have an overload of toxins in their bodies, fat-soluble toxins, that might cause people to increase their fat storage as a consequence of trying to handle this. Because unfortunately, when you have a lot of fat, there are, and we're exposed to all these toxins, unfortunately, they get stored inside. A lot of them get stored in the fat. And that's part of the reason why when people go through a large amount of weight loss, sometimes they can feel sick because some of those fat-soluble toxins can actually get released as the fat goes away. So correct, but it's not really part of the detoxification syndrome. It's a system. It's essentially an endocrine organ. We should think of it that way, that it's just not sitting there. That's the most important thing. A lot of us just think it's sitting there, but it's causing an overall amount of inflammation. Reducing calories can do the following: activate AMPK, the master switch, reduce inflammation, increase insulin sensitivity, or all of the above. And of course, everyone is getting that one right as well. All of the above. Same thing goes with, as we spoke about, that various strategies of fasting also do all of these things as well. They activate AMPK, they reduce inflammation, and they increase insulin sensitivity. Next, what is visceral fat? Your overall average fat percentage, the measure of fat to body mass, the fat that surrounds your abdominal organs, the fat left over after cooking a steak. Okay, awesome. You guys are really fast. You're answering before I even say the answer. Okay, very good. So it's the fat that is surrounding your abdominal organs and is the most dangerous fat in your body and the most inflammatory. And how inflammatory? When it comes to inflammatory cytokines, how much worse is visceral fat to regular fat? 3 times more, 4 times more, or it's less inflammatory? And it looks like everyone is getting that right as well. So this is something I'm so happy that you're remembering, because it allows you to really focus in on getting that visceral fat out of your system. And we'll talk about that in the next one. And maybe I think we didn't discuss this, so we'll see how you guys do. Which of the following is associated with a reduction in visceral fat? A, slow but very long walking. B, fast walking or high intensity interval training. Sorry, I didn't go over this. C, resistance training plus stress reduction. A and C or B and C. So A and C or B and C. And it looks like everyone is getting that right as well. It's B and C. Now, not slow but very long walking should be part of your overall exercise program. No question about it. Everyone should be able to work up to a consistent 1 hour slow walk. That's something that you should really work on getting to. But it should also be alternated with very fast walking or some sort of high intensity interval training. Stress reduction, we spoke about how important that is for reducing the overall inflammation. And weight training resistance training is very effective at getting rid of visceral fat. And the final question, what word or words do you look for on a label to identify a trans fat? Hydrogenated or partially hydrogenated, canola, or expeller pressed? Awesome. Everyone's getting that right as well. Well, you guys did great. So that is tonight's class. We are coming up on the end of the hour. We'll talk about, well, first of all, thank you all for your attention. And I'm glad it seemed like we got a lot of participation in the test. And it seems like people, people did very, very well. So some of the things that I was hoping that everyone would remember and take from tonight's class, you remembered, which is really, really awesome and makes me feel very good. And I'm so appreciative that you're all here. I certainly love doing this. And I look forward to seeing you next week. We're always here every Wednesday night at 8 p.m. on Eastern Standard Time. And look forward to all your comments, your questions. And I hope that you enjoyed yourself tonight. And stay well, everyone.